Tuesday, May 28th. Do we need to do an official roll call? We don't have to Dan here.
No, just workshop. You don't need that.
All right, fair enough. So I know you're probably going to hand it right over to Chief Stanley, but Mark, take it with you.
I think it's appropriately handed over to Chief Stanley. Just quick background. The community risk assessment is something that you can see it's dated to 2023. So this is something that the fire department's been working on a long time. One of the things is the possible certification or accreditation of the fire department, and this would be an appropriate first step. Even if we don't go there, this is still a good process to go through to see where we stand, see some more of our strengths and our weaknesses are, and how we can improve upon that. There aren't a lot of weaknesses because we are rated a number 1 fire department, which is the highest rating you can get. But obviously, to maintain that status, there's a lot of work that goes with that. So with that, I'm going to turn it over to Chief Stanley and his fine, capable group of management staff.
Thank you, City Manager Roloff. And council members, we appreciate the opportunity to present these 2 reports to you, and certainly value your time. We'll try to be very concise. So over the next 15 or 20 minutes, I'd like to hit some high points, take you through some of the different discussion points, give you a little more background and context to some of the things the city manager talked about, and then leave the bulk of the time for question and answers from all of you. So if I could start by, we have a lot of new faces on council, and probably many of you have not had the opportunity to meet some of my staff, from my executive team. So I'll let them introduce themselves and what they do at the department.
So I'm Greg Selter. I'm the Assistant Chief of Operations.
Hi, I'm MJ Van Gompel. I'm the Management Analyst for the Fire Department, and I've been with the department for about 5 years.
Hello, Brian Bendy, Assistant Chief and Fire Marshal, also in charge of facilities at the department 23 years now.
So Mark referenced a little bit about, why do a community risk assessment and standard of cover. It is, as we look at how can we continuously improve, make sure that we are offering, the highest level of services that are possible. What gaps do we maybe have that we need to close? Really shift over these last several years to a data-driven organization. So that the community risk assessment standard of cover is actually the second piece in the accreditation. We've already done a community-based strategic plan. Then we transitioned over into this second pillar of the accreditation process of the community risk assessment standard of cover. The city manager referenced our ISO rating. We do enjoy the highest possible ISO rating attainable, on a scale of 1 to 10. So for the ISO, 1 is good. So we're one of very few departments in the state and in the country that have attained that ISO rating. But what ISO really looks at is your ability to put water on a fire. Say they look at water distribution systems, hydrants. They look at our training hours, our staffing, our fire apparatus. It was designed to create an insurance rating for your risk of fires and that you can put fires out effectively. But it looks very narrowly at that. Whereas a community risk assessment looks at all the hazards. So they take into consideration the different type of buildings we have, the different things that we have in our community, i.e. airports, rail lines, highways, waterways, things like that, and how would we respond to those risks across a myriad and spectrum of different types of incidents. So they'll take into account not only the fire response, but also emergency medical services, special operations like hazardous materials, dive rescue, airport rescue firefighting, and looks at that broader base. And it makes sure that we have a safe and effective response to all those different risks. So it also identifies in that risk assessment the hazards and vulnerabilities and obviously the risks that each of those may create. That really becomes our guiding document. So to give you some historical perspective, that I've had this on my dry erase board in the office for some time. That it talks about from the Oshkosh Herald, the back in the day. Looking back, April 26th of 1959, when we had a significant fire in a car dealership, and it talks about 6 of the city's 7 fire companies were in action with 2 ladder trucks and 4 pumpers. You know, and that 65 years later is basically the same configuration for units that we have now. You know, so is that appropriate? Can we cover our risks? Are they located appropriately to respond to those risks? You know, so that's, you know, rather than just, well, this is the way it's always been done and this is what we have, this risk assessment and standard cover looks at how are you at covering those risks now and how will you in the future. So a lot of the evaluation tools they use are National Fire Protection Association or NFPA standards. You know, and what they're really looking at is what is our response time from the time that call comes in to 911 until we're able to be on scene. What's that time? You know, and there's industry standards associated with that, and what that time is measured against and what becomes so crucial, and you probably saw lots of reference to in these documents, is the effective response force. You know, just because one person gets there on a high-rise fire in 30 seconds, it doesn't mean it's going to go well. You know, that you have to have the right number of resources to mitigate that emergency. So that's what they looked at across all of those different call types, those risk and hazard types, is can you get your effective response force there in a timely enough fashion to successfully mitigate it? You know, so that's pretty much the measurement tool. You know, and as you saw, they made multiple recommendations in the study. And there's some things that are, you know, what I would call low-hanging fruit, you know, things that we can do internally, and many of those things we've already actioned on. Said, you know, yep, this is a great observation. This is a gap we can close. You know, this is a process or procedure we can implement. You know, and take an action on that. But you know, there are several recommendations that are going to need support or action from council that, you know, we can't just do independently, and obviously, you know, most of those are going to be because of budgetary constraints, and I'll talk a little more specifically about that in a second. You know, as City Manager Roloff talked about, you know, we've got a great department. You know, that we do have that highest level of ISO rating. That, you know, most of their findings were very positive. You know, that we're able to provide very, very high levels of service across the board. But you know, what we have continued to identify over these past several years is that the system is getting incredibly strained. You know, that in 2019 we did a staffing and deployment study. You know, in 2021 and 22 we did a facilities study. You know, just for the fire department. You know, separate from the one that the city did. You know, now we've done this risk assessment and standard recovery. We've played a lot of zone defense, and we've been able to do that for a lot of years. But you know, we're experiencing a very steady rate of rise in our call volume. You know, over a number of years, we've seen that continue to increase. You know, some of that can be because of an aging population. You know, as our community and society ages, you know, they're going to have increased demands and needs for our service. You know, some of that can be an increase in development as we've opened larger businesses, or as we continue to develop more and more housing opportunities. You know, as we're have completed, currently working on, and have plans for, you know, a number of multifamily dwelling units, congregate living for seniors. You know, that's going to increase your call volume. You know, that's you know, we've had a lot of increase in our type of demands for service. You know, from back in 1959 or into 1864 when we were founded. You know, initially was just to prevent conflagration so that we didn't burn the whole city down. Well, you know, the scope and needs of our services has changed immensely. Of emergency medical services, you know, emergency management planning, fire prevention activities, hazardous materials, dive rescue, water rescue, with all those things that were identified. You know, that is, the community continues to evolve and their needs change, you know, over the next 1, 5, 10, 50 plus years. How do we prepare for that? Yeah, and then one of the things that was identified in the staffing, or excuse me, in the risk assessment recommendations was our over-reliance on cross-staffed fire units. You know, that we've been able to play that zone defense a little bit, but that's, as that call volume increases, that's getting increasingly difficult. You know, so I want to spend the bulk of our time with you talking about, you know, probably our two most pressing needs that need some council intervention. You know, that the fire stations, you know, are outdated. that, we've done multiple studies, and I'll pass this around as well, but I just took some highlights out of those 3 studies that I referenced earlier. It keeps, starting in 2019 and to our latest study, from 3 different consultants, they keep referencing the need to update the fire stations. Most of you have come and toured the stations, seen what the living quarters are like. As we battle for talent, in this incredibly competitive market for any employer, but there are a lot of fire department jobs available right now. So how do we recruit and retain talent to spend a third of their lives in these fire stations? It needs to be, we need to have some gender equity, some privacy issues. We need to meet legal laws and ordinances and things like that around, privacy, nursing mother rooms, things of that nature. And, from the sliding scale of 50 years to 25 years ago that we built stations, lots of things have changed. A lot of research has been done. We're finding more and more causation of cancers and heart disease directly attributed to the facilities. Whether it's the alerting system or it's the ability to have decontamination zones so that we're not tracking carcinogens into the station. We've found more and more different ways of keeping our firefighters healthier and addressing their mental health as well as their physical health, and then getting them to retirement and having them have lengthy retirements rather than die prematurely from occupational related cancers. So facilities, incredibly pressing need, that as you see on here, that all of the stations need to be addressed, that they all have similar issues and concerns. That I'll also provide you, before you leave tonight, with copies of the facility study, of the staffing study that dives a little deeper into those recommendations about what needs to happen around those alerting systems and things like that. Then our secondary issue, is our ability to cover the city and keep that effective response force where it needs to be, keep units in service, reduce that reliance on the cross-staff units that, we, for the past couple of years, have been in the numbers to where we need a 4th ambulance. Right now, we staff 3 full-time ambulances. That, as all of those contributing factors, as I talked about, the call volume has increased. That's causing us to dip more into that cross-staffed unit where we're taking a fire company out of service to put 4th, 5th, 6th ambulance in service. So that's reducing our ability to provide fire protection in that response force. So we need to add that 4th ambulance to bring our utilization of the ambulances down, increase that reliability, and reduce the usage of that cross-staff model. That's an attainable goal because we have the cross-staffed ambulance, so we wouldn't have to buy and equip a whole other ambulance. We would just fully staff that. To make that occur, it would take 8 firefighters to staff that ambulance 24/7. And to account for vacation leave, things like that. We understand that that is a very expensive proposition, for pay and benefits for 8 firefighters. So to address that, we submitted an application to FEMA for what's called a SAFER grant that is designed to provide staffing. So we have submitted that. We requested the 8 firefighters. Should we get approved for that, that will pay for those 8 firefighters for 3 years. At the end of that 3-year period, then they would come on to be the city's financial responsibility. Years ago, they weaned you off over that 3 years. Now, since COVID.
It used to be 5. They wean you off of 5.
Yeah.
The old SAFER grants.
Yeah, so at COVID time, they changed it, so we'll just pay the full freight for 3 years before it transitioned to the city. So, more advantageous to municipalities. So we've made that application. The city manager and I have talked about it. We likely will not see the approval, or denial of that application prior to the budget. So we wanted to put it on your radar screen that particularly these last several years, they've been late in their projected timeline as well for notifications, and if a government shutdown happens, where it all stops. So we may not know about that until into next year, but certainly wanted to bring it to your level of attention. We are cautiously optimistic about receiving that, that we contracted with a grant writer to develop the application for us. Her feelings were, we certainly are not a slam dunk, because although our numbers indicate we need that, you're competing against everybody in the country. So our numbers are not as dire as some others we might be competing with. So she said, 50-50, toss of a coin. I think it's a really strong application. Luckily, the federal government has fully funded that and approved that funding, because that was in jeopardy as well of some budgetary reductions. That did not occur, so that we're not competing with a smaller pot, which is to our advantage as well.
Mike, can I ask you a question now, or would you prefer?
That pretty much wraps up my outline. So I want to open it up to questions and answers and dialogue that any of you may have. So sure.
So because it directly relates to the fourth fully staffed ambulance. I know when this was written, obviously we didn't know about the new hospital potentially going into the central city. Will that have an impact on how often this would, are you able to offload the passengers faster having that resource? How will that play into this?
Most likely, yes. We will be able to transition faster, because it'll be in the core of the city where the bulk of our call volume is. Right? What typically happens is that just means they will churn faster. So they'll still be hitting all those calls. The other thing that predictably is their call volume will go up because of that hospital and because of the development that we're planning in that lower downtown area, that with all the multifamily units, and people will follow the hospital. That's and not to get us too far afield, but in other agencies I've worked for, and what we experienced was, you build a hospital, they will come. So the proximity to the downtown area, to resources, the warming shelter, etc., that you will have an increased transient population that will float from that hospital to other facilities.
If I can just wait for 1 second. In our system, though, patients do have the right to request their transport destination. So we could just easily have someone who lives on Spring Mill Security, obviously right by Aurora, say, hey, my doc's at Theta, I want to go to the Theta Center, and we would take them. So it can work both ways. I think a lot of traffic in this area, especially some of the homeless who don't have established care providers, we'll probably be taking them there because they won't really have a request for destination. But other people further away in the city, we might actually be transporting farther. So now we're Med 16, that's the one over by the water tower there. Might have had a short transport from Spring Mill. Now they're going to be hauling them over to the Theta because the patient is a patient with a Theta doctor.
Okay.
And it's the aging of our population that is probably the single largest. We can talk about homeless and other things like that, but our aging population is really the key factor, because if you take a look at what you guys call hot maps, just showing where the concentration of the calls are, and you can see the areas of the city where there are either senior housing facilities or just a more elderly population in general. You see that the numbers really kick up there. And fall prevention is also one of those things that the fire department's been working a great deal on in recent years. And that fall prevention, that's one less call. And if we can get people to prevent a fall, we've prevented a call from happening in the first place. Plus, that once they start that first fall, they enter that sort of spiral. Thank you. And that starts making it worse as well. So that's why some of those efforts are there. It's not just because it's good PR and they're out there and giving fall prevention tips. We hope that they take those fall prevention tips and actually prevent a fall. So little things like Suggestions about getting rid of rugs or putting some skids on them so they don't go sliding all over the place. It sounds like it's just a nice PR thing. It's not just a nice PR thing. It's common sense stuff that saves calls for us. And that's where, if you take a look at page 11, there's some data there about how often our units are cross-staffed. And that's really the indicator of when you guys are getting stressed. Is that a fair statement, guys?
It is. In cross-staffing, if you look at every cross-staff call is when the system has failed. So we have 3 primary ambulances. Every time a cross-staff goes out, that is when those 3 ambulances weren't adequate. Obviously, the cross-staff system I think was more meant initially the inception, which was before my time, was for a lot of overflow or a major incident. So the bus flips over, you have to haul a bunch of people. Those rare times where you have a large number of patients, but we now use it as a routine measure to maintain our response call volume. And then the other problem is that needs to be considered is here in the city of Oshkosh, we're on a bit of an island in that we're not our neighboring community. Algoma doesn't have an ambulance. So we're like, hey, we're busy, send your ambulance over. Like, we don't really have additional response units that are local. So if we do need to call in, Gold Cross is typically the closest, or North Fond du Lac, either one figure about 20-minute response time to start. And that's if they have supplemental units available in, Neenah, for example. If their Neenah units are out there, be coming from Appleton or, even kind of east of the north end of Lake Winnebago.
Well, now that you've teased them, of course you want to share it with them.
Well, this talks about, just some of the hours MJ put together for us of the utilization of these units, of the cross-staff units. So 2023 is a big one. The other years of, kind of trend in the ballpark. So 234 hours of time that the units spent on cross-staff calls. So what that means is, that comes from a fire company. So 234 hours or 10 days where some part of the city didn't have a fire company because they were out on ambulance call. And, what does this look like? So Station 16 has been cross-staffed for a long time. It's again by the water tower, and as you know, it's kind of all by itself. There are not many other stations on the other side of the highway. There's not any station on the other side of the highway except for Station 16. So they're also clearly on the border of the county, which is also our ambulance service area. So all the ambulances go out, we get a call in the county, Engine 16 has to take Med 16 to respond to Amaro or wherever. Now that's an extended call time because they have to drive, maybe 10, 15, 18 minutes out into the county, treat a patient, return them to some hospital. And for that entire time, there is no staff fire station west of Highway 41. And that's really common, again, because our dispatch is based on vehicle location, automatic vehicle location, and if a call goes out in the county, Med 216 is usually the closest one. So that one is always going out, and then it leaves that whole side of the city empty. So that's when we talk about the problem with cross-staff is that, we have 6 fire engines, one gets turned off every time we send a truck out or send a cross-staff unit out. And it could be for 15 minutes to maybe, help someone who fell down. It could be for an hour and a half if we respond to an ALS call in the county.
Can you speak to, maybe I should know this, but I don't. Can you speak to how reimbursement works from those municipalities that use our EMS services, and then also I'm assuming there's reimbursement from insurance carriers?
Sure. And I'm not an expert, but I'll give you kind of the basic is that we charge a per capita fee. So basically, number of people in the municipality, and then they pay that amount back to us annually. And then we have a billing company. So when we provide medical care, then the billing company goes back, to the patient's insurance, just, as the same as if you get any other medical treatment. Based on the kind of treatment you get, goes to their insurance company and so forth, and ultimately possibly to a collections agency if they don't pay. So that's the 2 ways we recover costs, per capita, and then the regular medical billing, similar to any other medical billing anybody else would receive.
That's helpful.
The per capita, though, I think it bears a little more detail because the per capita amount is based on the net cost after the revenues are collected. So we do base it on, so when we do get, I mean, because so many of our calls are people on Medicare or, it's called private pay. What that actually means is they're not insured. It's just a nice, polite way of saying it. The bulk of our calls are those. So we don't get, it's not unlike, you know, many of us who have insurance, that's not the bulk of our calls. And that was a bit of a bone of contention with some of the surrounding townships and cities, because the fire department had done a calculation about what we were recovering, and we said we're not recovering enough. And the formula was challenged and things like that, but I think the fire department did a good job of demonstrating that the real costs versus the costs we had initially negotiated, the costs weren't really reflective. For example, we charged the least expensive fire personnel, not the fully trained paramedics. It was like the lowest paid. So there was somewhat of a discount on that. And so the chief made the presentation, but it was not well received because the amount we've been undercharging for many years. So getting people used to that was kind of a tough thing.
So we did raise that rate.
Yeah, we did,
okay.
And that'll take effect in the next year's billings. We usually do it like a year and a half in advance, so
okay.
They can plan budget-wise and everything. But that was an issue. But where was I going with that? The revenue, it's net. That was the per capita cost is really a net cost that we charge out. They're always looking for ways to up the revenue side. But the reality is, because so many people are Medicare and Medicaid, it's really dictated by the federal government what they're going to reimburse for. So if they say we could literally double our ambulance rates today, have a council approve it, and Medicaid will say, well, that's very nice. We're not changing our reimbursement amount. So who does that hurt? It hurts the people who are covered by insurance, not by the calls that are the volume of our calls, and that's really the challenge we have. So I know you were trying to just be polite, but it was a good question. I think it needed that depth of an answer.
Well, Mark, I don't know, I'm just thinking out loud here. That sounds like we have now a flawed method of billing. I mean, it's accurate in that if you're coming to my house and I'm going to the hospital, I pay the bill. I get that, but if I'm unemployed and I'm $300,000 in debt, you're not getting your money. So, I mean, wouldn't it make more sense to come up with contracts from the towns to have the municipality pay a set fee, and then the people that live in the municipality have a nominal fee that they would pay in every year to the municipality? It's kind of like the people that, have homes or whatever, however you want to charge it, are paying for those that really cannot afford that, and then you're kind of taking the rightfully so, I think, taking the responsibility off of those people that really can't afford it. And let's face it, these bills and medical bills are just absolutely unbelievable. So I don't know, is it something that we can look at, or?
I would say the answer to your question is we have looked at it, and once the sticker shock hit the other municipalities, they're like, how are we going to do this? Like, we got to move towards this, guys. We just have to. And I'm looking. These are the 5 people. Those 4 and me were the ones that came delivered the message, and it was not well received because the perception was that the timing was that shared revenue had just got an increase for all the municipalities, including them. You're just trying to get our shared revenue. Right. No, that's not the case. The case is that we've been undercharging you for quite a while, and we need to fix this. So here's the double-edged sword, though, because as it says on page 11, 83% of our calls are within the city limits because the concentration of the older residents and admittedly the poorer residents are in the city. So the fact that we're charging it on a per capita basis, a lot of the municipalities would prefer that they just get charged on an a la carte basis. And it's like, that's not how this group operates. This operates, we take care of everybody 24/7. We will drive out to the far reaches of Winneconne and Butamore, even though it does take us an hour and a half for just the ride.
If I may, Mark, one important note too is we don't charge anything if we don't provide medical care. So if we just go help someone who's fallen down, just, okay, you know, back in your chair. If we go to stand by at a fire operation in the county to obviously provide safety for the fire crews out there in the townships working. If we arrive at a call to find the patient has left, none of those things do we recover anything from the patient for, but we're burning diesel, we're burning tires, we're wearing trucks out, and it's our crew time too, and possibly this cross-staff time. So that's why that per capita fee is there, because there's a lot of stuff we just plain do not charge a penny for that is expensive for us to do.
And what we're really trying to realize is, and I think probably where you were headed, Councilmember Nichols, is, and you too, Councilmember Essinger, if you're in downtown Oshkosh or you're in Poygan, you call 911, you're going to get the same red ambulance that says City of Oshkosh on it with the same 2 firefighter paramedics. The per capita should be the same for the residents in the townships as it is for our residents in the City of Oshkosh. You know, it should be an equalized value of per capita so that our taxpayers are not subsidizing the residents outside the city. So, you know, that's why we move that direction and are transitioning and that price point in. You know, so to your point, Councilmember Essinger, you know, we were typically generating $300,000 to $400,000 worth of revenue for the transport services that occurred outside the city, and about $97,000 from the per capita cost. You know, it was not equitable for us. You know, so over these next few years, we will increase that per capita cost to realize that full value, so that it is same.
So what revenue do we get from the towns then?
So okay,
let me rephrase that.
Yeah.
From the municipality, what money do we get? Not from the person that we get, you know,
that per capita fee.
Mm-hmm. Okay.
So that for all of the townships, you know, we were generally averaging about $97,000. We took their population towards that low end cost.
So to provide the service, we set a standard fee for the town of Algoma, Black Wolf, Macomb, whatever.
One of the questions that I had, just kind of looking at these recommendations, I know that you had mentioned this when we met earlier, Station 16, this is not a purpose-built location, and it's the only one on the west side of town. So when I asked you a few weeks ago what keeps you up at night, and you mentioned, you know, items about falls and response times, frequent flyers, this one is another one that stuck out to me. And so in terms of replacement and also for, you know, the health of the crews and everything, do you envision in the next few years this being figured into the CIP, or is that a discussion that has not taken place yet?
We have to have our CIP meetings with each department, with the city manager and the finance director. That is certainly going to be my recommendation, you know, to try to address that, because Station 16, temporary, you know, designed to be a temporary building, 40 years ago that we've been occupying, you know, and it is. The roof is separated from the structure. You know, it's got a number of structural issues. It is in a horrible location next to the water tower. You know, the ice from the water tower falls off, hits the station, hits the firefighters' cars. You know, no way would we want to put another station there at the base of a water tower. Where it's at, the busy frontage road, the proximity to the roundabout, you know, the impact it has on tires. So then when, you know, City Manager Roloff talked about the heat map, you know, that's a very busy station for us. But where the call volume, when we look at the historical call volume and the development of what that call volume will be, it needs to pull that station south and west. You know, so it is a horrible location for a number of reasons for us to operate out of. And then you are exactly correct, Councilmember Fulham, of, you know, it's a horrible station. You know, it is having, you know, impacts on our firefighters' well-being, you know, because it is not built to anything close to Mauder standards, you know, or anything close to what we've talked about around those health safety issues. So that station, you know, has been consistently identified in the station study and the city's facility study of that it's a high priority item to be replaced.
So the first priority for the fire department was the training center on Sawyer, which is going to get started later this year. And then 16 is the next station. And we've had, Chief and I have had discussions with the town of Algoma because we looked at the ideal location, using the heat map to say where would this be best positioned based, and it also has to be based on available land. Pretty much along Witzel is one of the better locations that would not detract from service to us, but would place us in a good position for service west. And we've actually had discussions with the town of Algoma about property they own. Now that sounds unusual that it would be in that station would be a city fire station located in the town of Algoma. Admittedly about, a quarter of a mile in, not way in there, but honestly you go too far west, the benefit doesn't really matter to the west, and it starts to detract from ours. But that's a good location. If it was in the city of Oshkosh, in the city limits, it would be equally as good. It just happens to be in the town of Algoma. So we've had discussions with them. They've had some changeover in leadership over there, so those discussions have gotten gotten going as of late. But that is the next priority station-wise. But there's other stations. You can see just the 16 through 19 were all constructed in the 90s, and they've hit their 30-year mark, and that's when they start to show, especially given the styling and the architecture of the buildings. They were kind of low budget, to just be honest with you.
Yeah, low bid wins.
Yeah, and it was like, let's be very basic, and the chief talks about, he's not exaggerating, maybe they did this on purpose, but my first visit to Station 16 was in the dead of winter during a thaw, and they're not kidding. I mean, if one of the drivers has been out, in a run in the middle of the night and try to slip back into bed to catch a few winks, and it's starting to melt in the winter thaw, literally this station sounds like it's getting bombed because the ice just slides off the top of the water tower and lands directly on the roof of Station 16. I'm sorry to even use that tongue-in-cheek, but it is not as funny when you're trying to sleep there. And the roof just takes direct hits on it. So it is not the greatest location, and it should be moved, but strategically as well as for those reasons.
Then the follow-up, community risk reduction, one of the things that you talked about when we met last again was people calling in on a frequent basis, and they may not necessarily need the Oshkosh Fire Department. They may need a different service or a different provider or be steered in a different direction. That kind of requires a more proactive education strategy. How has that been coming?
That's very good, because as we talked about, that many times we are a mismatch resource-wise because we provide one option. You can go to the emergency room in an ambulance. That may not be the service that they need. So we are very interested in exploring what other type of resources can we point them towards, that would be more efficient, and provide better outcomes for them than rather than just you're going to go to the emergency room and get a bill from the ambulance in the hospital and get this huge medical bill like you were talking about, Councilmember Eslinger. So I'm very pleased to say I had an opportunity to meet with the Winnebago County District Attorney in these last couple weeks. He's going to convene a work group to address that, with the advent of what they're working on with the mental health courts, and get all the right people at the table to have those discussions, so that we can be more involved as a fire department in the care and case management of these super users. Additionally, you'll see some different things probably in the near future come before you. Been working with the city attorney's office and several in the finance department to look at how can we curb some of those behaviors. And with our ambulance billing company, as Chief Stelter talked about, if you call me to pull your socks up, there's no fee associated with that. So how can we change some of that revenue generation and also try to create some deterrence to the behavior of abusing the 911 resource, either because you're not getting adequate care or you can't get along with your neighbor, sometimes. So you'll see some of those things coming before you probably in the next several council sessions is what we're hoping for.
Chief, can I go back to the, I think it's a federal grant for the firefighters / paramedics?
Correct.
I want to go a little more in detail on that. So they're going to cover that for 3 years. Is there a requirement for the city then to keep those individuals for any amount of years?
As memory serves, no. And that's a situation that has occurred, and then you also, if they are in risk of layoff, you can reapply.
Okay. So then, I'm just thinking of the different groups that would be involved with that. Number one, you have, what would be the difficulty of hiring someone where they know that they could be gone in 3 years? Number two, how does that affect the unions? I mean, now is that a bargaining chip for one of us? Either way, the pay for that, and then as far as from the council standpoint, I mean, if we can get ourselves to a point where this is, and I'm sure this will be very advantageous for us, but of course then you have a cost with that. Now I will say, and I've said it a million times with the police and the fire department, I'm just not going to go into you or Chief Smith on what we need because with all due respect, I don't know. And so we've put our faith into you guys that, and I have, I mean, you guys know what you're doing, and I think it's a great program. However, we have to talk to the citizens, and when we have tax rates going up and reassessments and wheel taxes and all these things that are going on, we have to sell that, that it's going to cost, at the end of 3 years, it's going to cost something. Now, I think the advantage we have here is this is what we do. I mean, the police department and the fire department, on the hierarchy of government, that's at the top. And so when selling this to the general public, I think is probably a pretty easy thing. But I don't know, like I said, with the other aspects going on here, now you have the employees, can they be fired? Is that a union thing, or how would that work?
Sure. That's, really, as I talked about, we're at the breaking point. We're spread so thin. So, I mean, obviously we're very, very sensitive to the impact on the taxpayers. I'm a City of Oshkosh taxpayer myself, so that's why we looked at this SAFER grant to how can we minimize that impact, and push that further down the road away from, the different assessments.
Good job, by the way. That's great. Yeah.
Thank you. That's now relative to layoffs. The city always, even within the collective bargaining agreement, we set the table of organization. So we decide how many people will have at each rank. For me, honestly, I'm not too concerned about the potential for laying them off because we can always absorb them into it through attrition. With the increase in aging workforce that we have, just like everybody else with the retirements, we could absorb them through attrition. That I don't see us laying anybody off. I don't see a firefighter in Wisconsin getting laid off in the next few decades, realistically. Just the way the hiring market is and the way the retirement bubble is trending. So I don't see us being in between that rock and a hard place. Now, take those 8 firefighters away, notwithstanding, I mean, we always run the risk of economic collapse would impact staffing levels across all of our city departments. So I mean that's always out there, at the edge of the radar screen threat, but not something I'm as concerned with. And we said we're at that pivotal point, as we talked about convincing the taxpayers of, and I say all the time to my team, it's just math. If the demand for service continues to increase and the resources don't, you have to decrease the services. So we're at that pivotal point of increased resources or decreased services, but we can't keep doing less with more.
So Chief Stanley, I have one more question. So if adding this dedicated 4th ambulance, do you see that impacting your rate of non-retirement attrition that you're facing now? People go into other departments, or is it going to create a better workplace for your staff?
Absolutely. The firefighter paramedics are assigned to the ambulances, quite honestly, are taking a beating. That they are overutilized. So they're getting beat up they're running a bunch of calls, they're tired, I can go somewhere else and have better living conditions, respond to less calls, the students at the technical colleges and stuff are keenly aware of that issue. So, if they see for a recruitment and retention aspect, huge for us of, you can come here and, not just get crushed, and be up all night, night after night after night, and, sleep in a crummy station, and, all these things tie together, for our recruitment and retention. So to your question, absolutely, I think that would be incredibly impactful to help staunch attrition, and to increase recruitment.
Yeah, over the years, I mean, it's sort of a double-edged sword again. On one hand, the folks they take out of the tech colleges, we offer both firefighting and paramedic. So if you want a job that has a lot of value and a lot of return on your investment, I'm doing this to help people. This is a great job to help people because you're helping people a lot. There are some departments in the area where you're just doing fire, and that's not as exciting until you're running these calls 3-4 times in the middle of the night. Then it starts to wear on you, and I think that's where the deputy mayor is going.
To put maybe some numbers to it, of the last, 5 or 6 people who left through resignation at retirement, all but one went to smaller departments, which is, granted, it's not data, but it's an indication that maybe the workload was a little heavy, and that's one thing obviously we're trying to reduce here by having an extra ambulance.
So the extra ambulance, this is not intended to be a financial discussion because they're focused on the operational side of things. That's about $1 million a year. And with levy limits, I mean, Councilmember Nichols and I were discussing, that today a little bit. The levy limits are probably the biggest impact. So for 3 years, we do get it covered. It used to be you wean off of it over 5 years. So it was 100%, 80%, 60, 40, 20, 0, and you had to keep it maintained through that 5 years. So now the good news is you only have to maintain it for 3 years, but then you're completely cold turkey after 3 years as opposed to weaning it. So that is more of a shock on the financial system than the weaning off it. So it's kind of a, pick which one you think is best. The finance director would probably say they prefer the 5-year approach, but these guys like it because they can go 3, they can do it immediately, it gets immediately funded. If we get approved for a grant, it's easy for the council. Of course we're going to say, yes, we want this, because we get a whole new ambulance unit, but after 3 years, then the bill comes due, and then the sticker shock sets in. So it's kind of a mixed bag.
Is the grant just for employees, not a apparatus or a?
It's just for employee salary and benefit. Okay. So like we was taught to provide uniforms and.
But we need another ambulance then, right?
No, we would use one of the cross-staff ones that we already have ready to go. We would just put full-time bodies on it rather than pulling them off the fire engine.
Yeah, but eventually you're going to want that unit to get upgraded. That's how they'll do it in the short run. They'll do it because if you ordered an ambulance today, what are you getting in 2-3 years? Mm-hmm. Yeah, you're not getting it automatically. You can't go down to the local ambulance R Us and get a unit type of thing. So, but that's real. I mean, in truth, that's really just more of a how could we implement it immediately? That's how we could implement it. But eventually, I mean, we were teasing Chief Stelter earlier about being a gearhead. He's going to say that ambulance, you start putting that on duty, that 4th ambulance is going to get very old very, very quickly once they start doing it. So we would need eventually to have a 4-unit replacement cycle. So, I mean, we have to be ready, and then we have to have a backup unit for all 4 ambulances, not just, I'm not trying to be the killjoy, I'm just for like operationally, the numbers are bubbling up, and that's why the cross-staffing, you have the opportunity to hear the needs are. The costs, I can bring Julie in and she'll depress you on that. But, I think these guys have to just talk about the realities.
Chief, if I may, looking at these cross-staffing numbers, how do we compare in terms of our rates and hours dedicated to cross-staffing to other municipalities in the area and ones of our size?
That's a hard comparison to make because the other municipalities aren't, the other fire-based municipalities are not doing transport. They don't have, Appleton is not in the ambulance business. Needham and Ashe is not in the ambulance business.
It's Fondy and Green Bay.
Yeah, that's, so comparatively to those two, I would wager our cross-staff numbers are high. When you look at what we're projected for 24, that's 9 24-hour days. We're down a fire company.
So what about like Racine, Kenosha, Janesville? Do they transport at all, or?
Many of them do, yes. So, and you look across the country as well, the utilization numbers of our ambulances are high. The kind of sweet spot is 20 to 24%, that we are consistently that 24 to 26. So our utilization is too high, and we've been trying to do a number, and our response times keep getting increasingly higher because the ambulances are getting, first ambulance you should have respond is out, the second ambulance you have to respond is out. So those longer travel distances, we've done a lot to try to mitigate that with automatic vehicle location and some of our response assignments to that point where there's no more tricks. So our utilizations for the cross-staffing are too high. We should not have, 9, 10 days, 2-week time periods when we're down, cumulatively down a fire company. So I know that we're bumping up against the council meeting and over on time. That cannot say enough how much we appreciate your time and the great questions. I know this is a lot of information to digest, metaphorical drinking from the fire hose. Should you have more questions, please follow up with us. Happy to answer whatever we can. Like I said, we've got copies of the station study and the staffing study that we'll give you as well. So with that being said, again,
this is a good opportunity to remind my newest council members, if you have not had a chance to visit with the chief and take a tour of his facilities, this is a great time to do that in terms of information's fresh. I know him and his command staff would enjoy nothing more than to take you around and show you around what he's talking about right now, and then to actually physically see it, get a little better perspective. So with that, we'll adjourn now, and then council meeting in a few minutes.
Thank you for your time.
Thank you.